I think we can directly go to the speakers and then have an open discussion rather than talking amongst ourselves. So I think we'll have a better idea of what people think about Ayurveda, Unani, homeopathy, yoga, naturopathy, Siddha, and all that stuff that is being taught in India, and how it is going to benefit the Indian population. It is not going to benefit anybody out of India. We are the ones who have to get benefits out of it. So that is what we are going to discuss here.
Yeah,
Abby, before
before.
we go to the speakers, do you have anything to say in context of the title? Like, is there any benefits of teaching pseudoscience, or is there? Do you want to
Yeah,
expand on that a
yeah.
bit?
I would like to rephrase that. I would say, the discussion would be more on the benefits of teaching alternate medicine in India. So, what are the benefits? Rather than terming it pseudoscience, I would like to say alternate medicine.
CAM, complementary and alternate
Alternate
medicine.
medicine, yeah.
The- there is we need to recognize that we don't have enough modern medicine doctors in a country like India, and this is what has forced this. There is there is a real need, but instead of providing proper care, proper medical practitioners into the medical sector, the that gap has been filled by these quacks, and quackery is a way of life in many parts of the country, and they don't recognize the difference. It's not easy for the armed janta to recognize or discern the difference between a modern medicine doctor or a homeopath.
Yeah,
I think
so
the first speaker is.
one point is that I was just looking at the in Europe and UK, in Europe, UK and US countries, what actually happens in training in alternative medicine, and actually I don't think any of these countries have such a very rigorous and very focused course like what we have in India. Most of the courses in the UK and the US are basically diploma courses where they have to attend classes 2 days a week over 4 years, and the classroom classes are very less. And ultimately, they actually pass out with a certification, like a diploma, and they are given a characterization known as ND, which is Doctor of Naturopathic Medicine, and then they can go practice chiropractors and osteopaths. They can all go and do a little bit of homeopathy on the side. So I think India is the only country that is very serious in teaching alternative medicine, if you look at the Western world. And I think in that sense, India is quite progressive, because India wants to teach very focused and very, very beautifully alternative medicine to its citizens and young students.
I think it's about the reason why CAM or alternative medicine is not taken seriously in most mature democracies or civilized countries is it's because they have the luxury of informed choice. They are aware that there are choices, and this is something that they do by their own free will. In India, it's not a matter of choice. It's the inability to understand the difference, as well as the misconception that there's a cost factor attached to it, that it is cheaper, whereas it's really not cheap. Some of the medicines that we have seen are quite expensive, and the way people spend their valuable time with this sort of quackery will take them away from getting proper care from a modern medical facility. So this is really hurting. This hurts, and why this is not taken seriously is because the people who are hurt are not people that matter. This is the the real reason. They don't consider the poor or the destitutes as people that matter. Nobody cares about them. So you are free to practice whatever quackery that is available on these people, and that is a sad thing.
Another factor
Okay,
is the
Nishant.
insurance, Nishad. The insurance in the Western countries and over here. I mean, the insurance is not willing to cover these kind of alternate medicine therapies.
Regulatory, the
Yeah.
regulatory action of insurance companies and a systematic approach to treating illnesses. Even modern medicine doctors, like family doctors, won't be able to prescribe certain treatment or methods or tests unless it is approved by insurance. So there is a secondary check where there are qualified clinicians sitting on the other end at the insurance companies verifying these requests. So this approach of a secondary check, at least there is another person who's looking at this. In India, there is nobody. It's the pharmacist and the patient. The pharmacist actually prescribes. The patient doesn't even have to go to the hospital. The pharmacist will decide, okay, what's your condition? You can take these. It's uh, that bad. So we need to address this at a much more human level. That there's a human cost to quackery, which is not being addressed.
What is an
Nisha, maybe we
antidote?
can go to the first speaker, who is Arun. Arun, please go ahead.
Kaipalli told that it's a matter of free will of choosing treatment modalities. Like I'll give you an example in US. Like there was a child, I think he was diabetic or something, and they didn't take him to a doctor, and they kept him with the church. So what the church told, they followed, and I think ultimately he died or something, and the parent was responsible for this. If the same thing happens with homeopathy, like if you take the child to a homeopath and the child dies, then you can't take this a parent to a court. So you can't say it's a matter of free will. So if it was a matter of free will, then allowing church to treat the child is also free will. So I would like to point that it was a analogy, something.
I don't. When you administer, when you neglect, it's called negligence. When a child is in need of medical attention, and if parents do not take the child to a proper medical care facility, that is considered as negligence. And in Australia, there has been a case in 2009 where both parents have been sentenced to prison, and they have been sentenced to prison terms for criminal negligence, and that was homeopathy. They had used, I think one of the parents were a homeopath. I'm not sure which. So
Yeah, they were.
they administered homeopathic Malayalis, by the way. They treated the child for some kind of a skin condition, and it did not recover. They didn't take the child to a medical facility, and the child died. So this is criminal. This is classed under criminal negligence. So informed choice is left to the parents to decide what to do with the child's health, and there is no two ways about it. The state is not going to look kindly on such parents. They will be taken to task.
Yeah, thanks for that explanation. Also, I would like to add, like, I think that science or scientists have been kind to these kinds of treatment modalities, alternative treatment modalities. It doesn't fight tooth and nail with these treatment modalities, which we should be, especially like a country like India, where people are barely literate. So they think that this is a legitimate treatment modality, and they don't know the aspects of how the treatment works, or because they don't know enough about these things. So I think it is it is our social responsibility to make people aware of this, and classify these alternative treatment modalities differently than what a modern allopathic medicine would be. So that a normal person can understand, okay, this is something different, this is something different. At this context, I would say, like, India treats Ayurveda, homeopathy, Siddha medicine all in the same basket, at least lawfully, uh, all in the same basket. So, that should change. And also, other thing which I would like to point out is, there is a paper in Nature which is a bogus paper on homeopathy, published in 1984. I pointed out this in some other discussion also, and I don't know why that paper is not retracted, even though many authors have criticized the paper, and they have shown the loopholes in those papers. And why this particular paper is not retracted is like an enigma to me. And I would like what Kaipalli would say about this. And the paper is about infinite dilution principle, what homeopathy is based on. It's a immunological paper. It's a very simple paper where you take immunoglobulin E and dilute it infinitely so that a single immunoglobulin E is not present in a solution. And then you add this to a mast cell, and the mast cell will release the contents inside. So this will happen only if antibody gets attached to the cell. So if it is infinitely diluted, this won't happen. And this is a bogus paper, and many people have tried to recreate this experiment and failed. And still this paper is available in Nature website until now. I don't know why the case is.
Are you certain that this paper is still available?
Yes, I'll send you the link.
Okay.
Okay, Krishna, you want to add to this?
And
Okay, Levin,
I
one of
wanted to tell you that the paper is still available, and so many people have tried to recreate it or replicate it, and all of them failed, right? But still, the paper is there.
Yeah, of course. I don't know why. Usually, what happens in scientific communities, if something is wrong, and it is wrong in many ways, then the journal retracts the paper. I don't know why this paper is not retracted. Maybe it's nature put it there just to show that, okay, if someone comes to read this paper, they'll get a lot of links below, which is like, even in nature there is papers which have criticized the paper like tooth and nail, and still the other paper is there.
Yeah, so Arun, 2 points I would like to add before Libin proceeds. One is you said modern allopathy, so that is a wrong term. Allopathy is actually something that was practiced in the early 1800s, and currently nobody practices allopathy except Ayurveda physicians. Vaidyas practice allopathy in the form of panchakarma. So they do bloodletting. They make leeches suck out blood from patients for various disease conditions. We had a discussion on that recently also, where an Ayurvedic physician said that they actually treat varicose veins using leeches. So what he said was that you put the leech on the varicose vein and then the nerve gets healed. So basically, they don't even know what a nerve and what a vein is. So allopathy is completely different, which is obsolete. That was actually used as a derogatory term by homeopaths during the time of Samuel Hahnemann. So we say science-based medicine or evidence-based medicine. I think that is the right term. And second is, you said that we are a literate group of people, but I don't think literacy actually guarantees scientific temper or intelligence. A prime example is a lot of doctors in India themselves. When I'm on Twitter, when I tweet about homeopathy or Ayurveda, a lot of cardiologists and endocrinologists and nephrologists, they actually come up and start fighting for Ayurveda and homeopathy and stuff like that. And some of them actually have given anecdotal experiences in their own lives where they have said that I had this skin disease, and I've been taking some modern medicines and that was not improving, and then I took this homeopathy medicine and I became better. And they don't even have that slightest knowledge, or I forget about knowledge, slightest logical sense to understand that there is a natural course of disease that can actually happen, and the disease can manifest in peaks and valleys and then go away. And homeopathy actually does nothing to any disease per se. And there are doctors like that. So if there are doctors, science trained doctors who are practicing cardiologists and endocrinologists and nephrologists, who are actually saying that homeopathy or Ayurveda has some role in healthcare, I mean, I don't know how we should look at from the general people point of view. It's going to be even much worse.
Yeah, Arun, I just want to add 2 points. The first thing is regarding the commitment of scientists who are doing research in homeopathy, and you were making a mentioning. You briefly touched on that. You told that scientists should be fighting with more vigorously rather than pampering the pseudoscience. And this is something which I fully agree with you, because there are a lot of people in science doing research who actually try to prove that the pseudoscience can still have an effect. So there are a lot of examples from studies mainly done in India itself, even from some of the reputed institutes, where what they're trying to do is that, like, their hypothesis generation is flawed. methodology is flawed, the results are not proper, and even the conclusion of the discussion is flawed. So from the beginning to the end of the paper, you can see a marathon of flaws and misleading information. But still, they still want to publish a paper just for the sake of showing that all these pseudoscience still have something in there. So this is, you're right. I mean, this is one of the biggest challenge, because clinicians or people who practice homeopathy has little much to do other than saying some anecdotes, but all they do now is to point to some papers, which is obviously most of them published in really predatory journals, but some of them even peer reviewed and not predatory, are done by researchers who actually go one step beyond to prove it. And this is exactly called using science to promote pseudoscience.
Papers, they are inconclusive. This is published not in any other journal, their own predatory journal. So they themselves say that this is just probably placebo. Now, where do we go from here? And Ayush Mantralaya has 3,000 crores allocated for all this sort of stuff, and so you can't say that they don't have money. They do have money, and that money is going in for whatever they think is fit. But and the research should be conducted not by proper scientists. It should be conducted by them, and they should publish it. It's nobody else's burden to prove a pseudoscience. So it is already proven that it is a pseudoscience. If they have evidence, they need to publish it.
Just Arun, to follow up on that question you asked on that 1987, that is actually the Ben Veniste study. So if anybody in the audience who actually wants to
Yes,
know
it
more
is.
about that,
Yes, it is
yeah, you just
still
want to
available.
just Google that word. I have spoken about this before also. If you were to take a tab and type Ben Veniste affair in Wikipedia, you can see all the references and for subsequent studies which has been done strongly disproving that. It was actually a technical error which happened by a technician, which lead up to this all conclusions. So Ben Veniste affair will give you all the information.
I would like to add one more thing, what Abby told. Why don't we call this modern medicine instead of allopathic medicine, which is like an archaic form of calling the same thing. So the problem is, if you go to an Ayurvedic clinic, you will see a modern scientific Ayurveda. So this is again a misleading term. I think we need to uh, clearly differentiate between this modern medicine and the alternative medicine. So again, if you use modern medicine as a to describe what uh, uh, modern scientific medicine is, then again the alternative medicine will add modern scientific Ayurveda, modern scientific homeopathy. So that is an issue, don't you think so?
Yeah, I mean, this is very well known that pseudoscience likes to borrow from science. For example, you look at homeopathy. So when somebody asks them, how does homeopathy work? Uh, First, it was water memory. Then came molecular imprinting. Then came nanotechnology. Now they're waiting for the next scientific term to come out, and then they'll use that. And in the same vein, in the same line, if you look at Ayurveda, now there is a group that is pushing something known as science-based, evidence-based Ayurveda. So I'm not sure what science-based and evidence-based is separately, but they have actually used the whole term. I mean, the whole stuff into their format so that people won't actually criticize them anymore, because there is science there and there is evidence there and there is Ayurveda there. So this borrowing and purchasing of terms from here and there is very common, and I don't think it will stop. But we have to say what it is. Modern science, I mean, or modern medicine, like we as we know it now, is actually science based, evidence based medicine. It's pure science based medicine and nothing more than that. So we stick to it. But we know when they actually are borrowing it, and homeopathy is a classic example of it, and Ayurveda is actually going towards it. And I think we stick to the right terms, people will finally understand it. And another reason why allopathy, that word is sticking, is that I have been going through a lot of these textbooks in homeopathy, and obviously homeopathy calls everything as allopathy, which is not homeopathy. And then they have antipathy and they have isopathy, all utter nonsense terms which they actually teach even now. If you look at Ayurveda textbooks, even that, in some of the Ayurveda textbooks that they teach even now, there are these footnotes. And in the footnotes, the authors have actually written that allopathy practice is harmful, allopathy can cause this, there is no cure for this in allopathy, and then they go on to describe their Ayurvedic scriptures. So this is what it's been taught. So a large number of students are actually learning these from their seniors who are actually not trained in science, and that is why these terms stick on in our community. And these science communications that we do on a day-to-day basis will actually break it, and that's what we keep on doing.
The next in the list, according to B, is Apurva. Apurva, please go ahead.
I don't think I have anything very new, but I would just like to reiterate the points made by Abby. I think a lot of general public have a concept in their head, at least in their head, there are different systems of medicine, which is false terminology or has only historic importance. There are no systems of medicine, or there are no alternative science. All the science is one. So there is no alternative physiology, there is no alternative biology, neither physics or chemistry. So anything rooted from those branches of science is just medicine. If there is evidence that something works, it is called as medicine. There is no meaning in saying that something is Ayurveda or something is Chinese medicine or something else. So if there is evidence for something works, then it is called medicine. I think we need to deconstruct this idea that there are different systems of medicine, which is completely meaningless.
Next is Chaitu, I think. Or Pranav, would you like to say something? Pranav is here.
No, I don't have anything to add right now.
Okay, if that is the case, we'll go to next person, who is Manchunath. Manchunath?
Yeah, just a request,
So
those who have done,
I
please move
think
to the
before that,
audience.
excuse me. Before that, I think that there is Jibin.
Yeah, can I speak?
Jibin. Yeah, sure.
Yeah, sorry. Yeah, I was just hearing the discussions, and like what I want to say is that, you know, since all these alternative medicines, they don't have like any scientific sides. And you will expect always like a big pushback from them. They will try to promote this in all the way possible because it's an existential crisis for them, right? So because if people don't believe that these are true, then they will, nobody will go to them, right? So I think they will push back from like all the ways they can. And I will just tell you one thing that happened just like few minutes ago. So the homeopathic people have started a new room like just few minutes ago. And I just asked a basic question to them, okay, you have this medicine for COVID, right? So arsenic album. So can you tell me like how many molecules are there? And they immediately, they just like threw me out of the group. So they don't have like any scientific basis for any of this thing, and then they are deliberately pushing like this thing to the people. So that's not what I want to say. Sorry, my daughter is like a little cranky today. So yeah, that's all what I want to add. Thank you.
Thanks, Jibin. Actually, I was there in that room. I have seen your presence. The thing is, like, they do not have any answer for that, because any answer they give is counter. Like for example, assume that they're going to give that an answer like nanoparticle. Hypothetically, think that they're going to say, okay, arsenic album contain nanoparticles of arsenic trioxide. But if that is the case, we can obviously ask questions based on energy medicines. They have a lot of energy medicines like X-rays, mobile phones, Luna, and everything. So how do you justify the presence of anything of these energies, or these waves, electromagnetic radiation, as a nanoparticle? Then they are done there. So they actually go for many possible explanations, but none of them will fulfill any criteria what they have to say. So yeah, the reason why you're kicked out is because first they started the room just to discuss anecdotes, and that is why I went there and tried to announce that we have a room here which is trying to provide more science and more research based evidences. And second thing is that, like, I think it's an echo chamber. They just want to cry it out loud. So they're gonna not gonna answer anything in any science perspective. They're gonna just talk their yeah, whatever.
Yeah, actually, my aim was to go there and like I'm a molecular biophysics, so I know like I know to do the calculation. So my whole point was that to make them tell how much of grams they start with arsenic album, and when they do the 30C dilution, how much was there. And I was ready to discuss all this calculation, but obviously they don't want to do that. Tara, please. So yeah, anyway, that, that that was my aim, which didn't work. Anyway, so
That's fine. Thank you, Jibin. I think next in our list is Nishav. Sorry, it's Manjunath. Sorry, Manjunath.
Okay, so I just wanted to say some things, right? Someone here said that we should call modern medicine as modern medicine, right? I don't think, guys, that's gonna work in a practical way. It's all about the marketing and political interest, because these guys have huge political interest. Because with Ayurveda, there's a sort of identity attached, right? And they take it very personally, and they lack the critical reasoning skills to actually reason with from a scientific point of view, right? So I think we need to work on that, and there's huge lobbying money involved in that, and a lot of social pressure, and that's why we have ministries after them. So I don't think just naming it as modern medicine is going to help. I think we need to lobby from a proper scientific, like scientists need to gather and properly lobby for it, and create pressure to recognize what is true and what is false. And we need to train our societies better for critical reasoning and scientific methods. That's all I had to say. Thank you.
But very interestingly, I just would like to add that, if the alternative practitioners, I mean, if you take homeopathy or Ayurveda or Siddha or even now Unani is also upcoming, all thanks to the Ayush ministry. Now, if you look at them, they actually, the part of their practice, and I'm not going to use the word survival, but it is what it is actually dependent on how they can actually badmouth or portray in bad light science-based medicine. And very interestingly, more than 70% of their curriculum, what they study in their bachelors and even in their masters, is actually modern medicine scientific textbooks. So, for example, if you look at Ayurveda, the only Ayurveda surgery that they are actually allowed to practice is surgeries of the anorectal region, treating hemorrhoids and fistulas and things like that. They're not supposed to do any other surgeries. And that is a Sharsutra is what they do. But if you look at the Sharsutra techniques that they even still use now, that the primitive old Sushruta kind of technique, they still read Bailey and Love textbook of surgery. In their masters, they actually read the whole of proper surgical methods for all other surgical treatments, but they're only allowed to practice that. So even if they actually neglect or ignore or badmouth modern medicine and science-based medicine on the side, they are actually taught um, all of this modern scientific methodologies in their curriculum, and this is actually very interesting. And I don't know how this actually comes out in the open once they actually start practicing. How much of this they actually put to logical sense? Because once they are reading scientific textbooks, if they have a good logical mind, a rational mind, they should know that the treatments that they are going to give the patient is absolute nonsense, and this is not happening.
I think because most of the people fail to question why they are learning that. They just learn, and because our system is designed for rote learning, right? So, and even the modern things, so there's this issue that people call it the Western medicine instead of calling it modern medicine. So there's this identity attached to it that it's not ours, and we somehow fail to compensate for that, and that's why we tend to trust with more Ayurveda and everything. So I think that's where the issue is. The marketing is done in such a way.
Hello. I was thinking like every civilization, every ancient civilization, has had their what is it, healing practices and whatnot. Um, we don't seem to take each of these healing practices seriously. But in India, we have a system where an ancient practice or many ancient practices have been included in the syllabus and given some kind of status on par with modern medicine, and that is ridiculous. You don't find that anywhere. I don't know if there are other places which do this. It's this belief that somehow we our ancient past is unique and special and different from all the other civilizations and other ancient things and healers and all those the so-called ancient knowledge and whatnot that they acquired. So that is a very huge problem in India. And when you add the present scenario, with the whole Arsha Bharata Samskaram and all that nonsense about the Make in India stuff and all the stuff, you add that into this psyche, and then you have a toxic mixture of something which is just ancient healing practices, which are based on whatever observation that they had, and lots of so-called knowledge based on some methodology, ancient methodologies that they had, which is not special, which is not better or in any way unique when compared to other ancient practices, and we have that in universities and whatnot. So, is pseudoscience? Is there any benefit to teaching pseudoscience in India? Definitely not. But at the same time, I wonder if India is the only place where pseudoscience is being taught and given any sort of recognition.
In fact, a lot of I mean, I think this is all behind closed doors. We don't know the actual numbers, but there are a lot of homeopaths and Ayurveda practitioners who actually don't practice homeopathy and Ayurveda per se. They actually move on to other other professions. So we have where I studied in my institute, we had a team of clinical data collection researchers. I mean, they are part of a clinical research team. They do a lot of data collection. They were well versed in statistics. They trained in statistics, and most of them were homeopaths, and they were happy collecting clinical research data, and they were publishing good work from our institute. And when I asked them, why did you actually not practice homeopathy? Why did you quit? So at some point, they understood that they are actually misleading the people. They are actually defrauding. It's not even misinformation. It's actually defrauding the people, especially with homeopathy. Ayurveda, yes, a lot of them feel that they are doing good to the people, good to the community, because the inculcation is like that. Because Ayurveda is not just medicine; it has a lot of cultural, religious, spiritual, a lot of stuff comes into it. So your brain is actually fogged with Ayurveda, and many people think that it's actually working and they are using it for the good when it is not. Homeopathy is right. I mean, on the face fraud, and this realization comes to a lot of these pass outs, and they actually start looking at various other professional options. So are there benefits to it? I don't think so.
There are no benefits to it whatsoever. Probably I phrased it wrongly. What I was thinking was if there was any other country where their ancient practices and whatnot receives this kind of state-sponsored status. That's what I was thinking
Yes, I
about.
mean,
And how we
China is well
China.
known for
China.
that.
It's China.
China.
Oh yeah, China. Okay. Yeah. So and all right. Okay. I mean, it's just I'm just wondering how we got into this predicament.
I think we can move on to the next person.
It's Hemant in the list. Yeah, Hemant.
Hi, doctors in the panel, and I'm also a doctor in modern medicine. So I have previously come and talked with Dr. Arif also regarding this, but that was in that was about homeopathy and its rule and its principles. Today, I would like to express a few views about this. What I think is what, and I had a background in homeopathy through my father, but I do question him a lot about these things, and I found many loopholes. I mean, in the explanations, I would say, in the scientific explanations, that's because this homeopathic science, what people consider. And Ayurveda also had been, I mean, these were the practices, I mean, centuries and thousands of years ago. Homeopathy would be
What
like
homeopathy?
homeopathy is 200 years, 150 to 200 years back thing. So, this had been, I mean, problem is that the further developments and development of theories and hypotheses and proving was actually not done in a proper way, I would say. I mean, the principles, I mean, we could say this is a cause, this is the effect, but we couldn't able to like link this we couldn't explain. I mean, the mechanism from the cause to the effect was a problem in those in the 18th and 19th centuries. So the problem is that
Hemant,
because
Hemant,
of
Hemant,
hello,
could you explain
yeah,
how
Tony, before you before
homeopathy?
you before you go before you go there, see, what is the effect? There is no effect. You're talking about effect in homeopathy.
And,
What is the
and Hemant,
effect?
you mentioned about homeopathic science. There
yeah.
is nothing called homeopathic science.
Let me complete my complete my talk.
Yeah,
So
Yeah,
Hemant,
sure, sure.
when you
Go ahead, Hemant. Go
I
ahead.
would like
yeah,
to, yeah, yeah, I have
when you
a few
complete it,
details to add. Yeah, yeah. I mean,
no, Hemant,
uh,
when you complete it, just add on to it because you said there was no proper research done in homeopathy the right way. So I want you
in
to
the right
add
way,
in
yeah.
your, yeah. So I want you to add in your view how to
Hmm.
conduct a proper research in homeopathy. When you conclude, you can continue
Yeah,
and just
yeah,
conclude with that.
yeah, yeah. I would like to say about that only. So, as we are taught about research, I mean, like we can use clinical trials, but not the conventional clinical trials because as patient and as homeopathy would be patient centered medicine, we need to exactly match the symptoms and of the patient with the most and most probable and most I mean the drug which matches this disease picture should be the best thing, and we need to do that in the patients. I mean, we cannot give the same drug in all the patients and check whether it is valid or not. And if that happens means that would be against the rules of the homeopathy, and that wouldn't fulfill that wouldn't be fruitful as well, because we cannot use the same thing according to, I mean, pharmacogenetics perspective, and as well as the pharmacogenetics perspective. And apart from that, I mean, we need to select the drugs. We need to according to the symptoms, because I may not tolerate cold, I may not but other can tolerate cold, and but he cannot tolerate hot. And there are many different aspects according I mean in this thing. So there had been in individualization of the symptoms. I mean, if we check the COVID pandemic or the present one, this would yield a different each and different drug for each person.
How much? What is the percentage?
Percentage,
What are your probabilities?
I
Let's hear
mean,
the probability.
yeah, I mean, what genus epidemicus is the term which is used when people have the similar kind of symptoms in a particular area. That could be due to the strain. According to the local immunity, they would produce a few similar symptoms. With this similar symptoms, we could actually use a drug as the prophylactic drug or the treatment as well, but tre- um, mainly as a prophylactic drug. But for the treatment, we need to consider differently according to their constitution. I mean, let that be their if I mean whether he could tolerate cold or hot. I mean that's a gross thing to say.
Hemant, I would like you to summarize what you actually want to
Yeah.
speak out because you're going here and there. So, what
Okay.
were
Okay.
your actual points? Could you please summarize for us?
Yeah,
I
about
mean.
how to do a proper research in homeopathy
Okay.
according to your view. Just make it
Okay. Okay.
crisp and
Mainly. Okay. Okay.
to the point.
So clinical trials, as I told, that would be according for the drugs, but pathogenic trials also, as previously Dr. Arif had, I heard him. I mean, the mechanism, I mean, the cause to the effect, what has happened means the mechanism is they couldn't able to describe the mechanism in a proper scientific way because of their constraints of development in other fields of science, which could explain about this. We need to like mm, that's what I mean. Simple
Sorry, can I
I
interrupt
would
you
like,
for a
yeah,
second?
yeah,
So I
I mean,
think
I would
there
like
are
to.
two aspects to it. One is you're talking about the effects. So there are multiple reasons why what you think as an effect happens. So there is something called as a natural history of disease. And there is something called as confounding factors. Then there are biases. Then there are logical fallacies. When you do a research, you take all of this into consideration. We'll put that aside for 1 minute, and we'll talk about the principles of homeopathy itself. You're saying that there are no research done to prove that the mechanism of homeopathy works. To prove that, you will have to first prove that the entire physics and chemistry known to humankind itself is wrong. The entire nature of universe and the physics, the fundamental principles and laws of physics are wrong. Unless you do that, you cannot prove that homeopathy works. So the homeopathic dilution is like adding one drop of whatever substance into an ocean and taking a cup of water from the ocean and saying that that works. That's what the principle of homeopathy is, which is not proved or cannot be proven by any known science or physics or chemistry known to mankind. So studying the effects is the next thing. So there is no scientific basis for the core principle of homeopathy itself.
I would like to add a few points. Actually, Apurva nicely explained about the principal parts, like the foundation in which homeopathy is laid on. What I want to add to you, Hemant, is that like we have enormous body of evidence, research which has been done, which shows that homeopathy does not work and it is not more than a placebo. One of the points you raised is that one possibility is that all this research cannot be done in the proper way because homeopathy is more individualized and hence every doctor treats a patient very differently with its own combination of medicines or its own potencies. So this is called the individualized homeopathic treatment where every patient is treated differently, right? There are even studies done using individualized homeopathic medications. So one group, the placebo group, got nothing, only the placebo or standard care. And the intervention group got individualized homeopathic medicines with their own preparations of whatever the molecules they're giving, medicines they're giving, and individual potencies, and still it failed. We have a lot of body of evidence showing that the individualized homeopathic medicines even failed. That is something you have to keep in mind. Don't think that people have not tested this because of the same argument raised by homeopaths. One group was given placebo, another group was given individualized homeopathic medicines, and still it failed. We have systematic reviews about it. We have tons of body of evidence which shows it failed. And the reason why it fails is just like Apurva pointed out, the fundamental principles are flawed. We have to completely change everything what we know about physics or chemistry, and it cannot simply work because it is far beyond stupidity. And the third thing I want to say is just because you touched on the COVID pandemic and about symptoms and prophylactic drug, you just went across that. So most likely what you're trying to say is about arsenic album, right? Because this is a medication which is given as so-called prophylaxis. And you also touched on something called local immunity and everything. So I'm going to sum up what is happening. So homeopathy is trying to give a medicine called arsenic album, which they claim is something called prophylactic. And since you cannot put the name prophylactic without evidence, they changed it to immune booster. Okay, so in order for anything to work as preventive or prophylaxis, you need to actually stimulate your immune system so that immune system is prepared. There is zero body of evidence, like literally zero, which shows that arsenic album 30C can have any immunomodulatory or immunoregulatory activities. Like literally zero. None. Hear it once again. There is zero body of evidence. The entire thing was based on what is written in a book called Materia Medica, where there is something called drug proving, and they just took it from that book and they think, okay, there are some symptoms coming, let's give it up. That's all. There is no research done, and they're just selling medicines and giving a false promotion for something which never works, has never shown to be working. I'm done. Thank you.
Yeah, Hemant, I would also like to add 2 points.
Yes, sir.
You did not actually give us what according to you is actually the right way to test a homeopathy drug. For example, you take the example of a viral infection. A simple seasonal viral infection that we get every rainy season. How would you go about testing a homeopathy drug if it's not the conventional way that we have to test a drug?
Now, ideally speaking, Hemant, before you give
Sir.
the drug, at least you need to send it to some lab to find out what's the active ingredient in that. Let's
Yeah,
say
yeah.
anything at 30C or 100C or whatever.
Mm.
So, how would you know what's the active ingredient in that before you give that medicine to the patient?
that would be that we would be checking through. Microscope. Electronic
Microscope,
microscope and
electron
uh,
microscope. You're
no.
sure? Shall I
No.
lock it there?
No. For a few.
30C
Some.
on an electron microscope.
The
Are you
source
sure?
of. For a few medicines, sources would be minerals. For some would be
No,
plants. Some.
my question is pretty clear. I mean, I'm asking you,
Mm,
before you do the research, before you give the medicine, you need to know what's
mm.
the active ingredient in that drug. Now, let's put it at 30C or
Yeah, I mean,
100C.
take the example of arsenicum album itself. How do you
30C.
know arsenicum album 30C has arsenic in it?
How do you know that? Through an electron microscope. Shall I lock it there?
I mean, through
Are you
chemical
sure?
analysis, I think.
You think, or
Are you
you're
sure?
sure? You know, you don't know. Just be
No,
honest. We have the
no, I
answers.
don't know about this, but what we
You
do
don't
is
know about it.
we do through
So you
chemical
basically don't
analysis.
know. You basically don't know if how to find the active ingredient in a 30C. Am I right?
Yeah, just I don't know at this stage of at this point.
So, Hemant, I'll tell you what. I don't think you even know the principles of homeopathy. And I think you have actually forgotten the actual principles of science that you have been learning, which you actually said when you entered. You said, I'm a modern medicine doctor. So,
Yeah.
if you are a modern medicine doctor, you would have studied biochemistry, you have studied pharmacology, you have
Mm.
studied pathology, you have studied radiology, microbiology, everything.
Yeah.
And based on that basic knowledge, I mean, I'm not just forget about your medical knowledge. If you are an 8th or 9th, 10th standard biology or chemistry student, you will
Mm.
know that homeopathy is utter nonsense, because something doesn't get more potent or powerful by diluting it. And anything above 30C dilution contains nothing. There is something known as Avogadro's principles, Avogadro's number.
Abhi, it's about
I mean,
12C. Just a correction. It's about
above 12C,
12C. Not yeah.
even better, even better. Above 12C,
Mm.
Avogadro's number gets locked. There is nothing in it. So how can you say that there is a cause and an effect? I mean, you can make blanket statements like any homeopath does. It is acceptable because they can only make blanket statements. But where is the evidence to show that? I mean, homeopathy works
I
for
mean,
no disease.
I
No
mean,
disease.
can we explain through? Law of hormesis. Hormesis. I
Libin,
mean, hormesis.
Yes, yes,
HORMESIS.
yes, yes,
Libin
yes.
hormesis.
Please go with hormesis. Please.
Hemant,
Do you want to first
please
explain
discuss.
what
Yeah.
hormesis is for the audience?
Why
Yes.
don't
Hemant?
you explain, Hemant? Why
Yeah.
don't you
Do you
Hemant,
explain
want to
that
please
to the
explain
explain
audience
hormesis?
hormesis.
first?
Yeah.
Dr. Sagan.
Then Libin will.
Okay, I mean, drugs. Drug concentrations at higher concentration that would generally inhibit that would inhibit those receptors, which drugs. Drug would be a ligand, and there would be receptors. Where this action. Those action would occur, drug binding to the receptors, and that would produce a different that would produce an effect, and the same, and at lower concentrations that would product an opposite effect. If drug binding in higher concentrations would be producing inhibitory effect, the drugs which are diluted would produce reverse from the inhibitor, that would be stimulatory. I think I think I have concluded about this.
Okay, Hemant, just for the clarity, so that everybody can understand what hormesis is. In a simple terms, hormesis is a concept where, in a higher concentration, something acts in a particular way, and in lower concentration, it acts exactly the opposite. For example, in a higher concentration, if it is stimulating something, in lower concentration, it's inhibitory, or vice versa. In higher concentration, if it is inhibiting, lower concentration, it's stimulatory. Okay. The problem is, hormesis is not homeopathy. And you can just take a tab in your phone and type hormesis is not homeopathy, and you'll see a published article where it clearly explains why both are different. Hormesis is one of the last resort homeopaths have to try to explain hormesis, but both are fundamentally different. Main reason is because in homeopathy you need to have, sorry, in hormesis you need to have something measurable in order to do in order to explain these effects which I'm telling in hormesis. But in homeopathy there is no measurable molecules or things which can explain hormesis. And this is only in the context of things which are like, for example, particles. Okay, what about energy medicines? How do you explain hormesis in energy medicines like X-rays or Luna, or say for mobile phone? You cannot. And the most important thing, keep in mind, homeopaths who say that homeopathy works is because of hormesis has to then take the materia medica and burn it out. You know why? Most of the drug provings are done at extremely low dilutions. The arsenic album 30C is proven by the Center Council for Research in Homeopathy in healthy individuals at 30C, not at higher concentrations. There are even literature available in their own website. So, if that is the case, a 30C in a healthy individual causes some symptoms. Suppose the so-called symptoms appears, and in the very same thing in a diseased individual or so-called preventive, it do the opposite. That is pure bluff. Okay, so everybody in the audience, please take and check it yourself. Just type in the tab, hormesis is not homeopathy, and you can see the reason why it is already debunked. The second thing is most of the most of the materia medica, they have done the drug proving not at higher concentration, lower concentrations. Okay, and it is a last resort, because there is actually a guy who is doing a lot of research in in hormesis. I forgot his name. And when he first he's probably one of the only person who is still supporting the hormesis. His lab gets funding for that. It was one of the last resort for homeopaths to say that it could be hormesis. And just to clarify, that is not right. And more importantly, people have done experiments to show that also, including the labs in IIT Bombay, and they have failed to demonstrate hormesis in a proper way. In a proper way, even the control or the ethanol behaved hormonetically like the drug. That is an important thing. Okay, so please educate yourself about hormesis. Hormesis is not homeopathy. Most of the drugs in materia medica is done drug proven at lower concentrations. So the hormesis doesn't work there, and it doesn't work in energy medicines. If hormesis is true, how do you even have energy medicines? It's simply a bluff. Okay, so just to keep that in mind.
Yeah. Yeah. So, Hemant, basically in hormesis, you actually need a measurable drug. In homeopathy, there is nothing measurable. So your hormesis theory is out. Do you have anything more to add to this?
I mean, I have a few doubts to ask also. We have like
Go on.
different potencies like 12C, 30C. I think that would explain about the different concentrations which we are talking about.
No, you are getting confused. I mean, you are trying to extrapolate something to something that actually does not fit at all. What it means is that the higher the dilution, the more the potent it is, right? So that means it should have some measurable equivalent in, 100C or 30C for it to actually have that hormesis effect. But there is nothing beyond 12C. So hormesis does not feature here, whatever concentration you bring it. If you look at a lower dilution, that means it is lesser potent. It should not work as good as something at 100C. So you're contradicting yourself. So your hormesis theory is out of the window. So something else, if you want to bring on the table, please.
Yeah,
You
I
can
mean,
actually check this article,
mhm.
Homeopathy and Hormesis, the artificial twins, or Hormesis or homeopathy. You can check it out. It clearly, the authors have laid out from reference studies that how homeopaths found a way to bluff it out. That's the right word I'm using. Hormesis is not homeopathy. And if they really stick to that, if you lock it to there, then materia medica is proven to be wrong. That's very simple. You cannot have materia medica and say that we do drug proving at 30C, and then they can go behind hormesis, all the energy medicines. So you cannot hold everything. If you stick with homeopathy, so sorry, hormesis, materia medica is wrong. I mean, it's
Even
already
not
wrong. We
just
know that.
materia medica, the whole homeopathy goes out of the window.
Yeah, out of the window. Yeah,
The whole
you cannot
homeopathy,
hold both at
all
the
the
same time.
principles are wrong. Yeah, it's completely
Yeah,
wrong.
yeah.
I think the homeopathic dilution is something like taking a drop of ink, putting that drop of ink into a big ocean, and saying that now the entire ocean across the world is all ink, not water, and you can start taking the ink from the ocean and start writing.
Abby, am I audible?
Yes, Arif, please.
Can I add something to
Of
this
course,
discussion
Arif.
Hammond was making? Actually, this point about this hormesis, that's a that's a crap which I had learned from my college itself. So most of the time when we criticize homeopathy and the way this potency is making no sense at all, this one is something which is taken up as a last resort by all the apologetics of homeopaths. So the problem here is, first of all, we need to give a definition for homeopathy. So we usually say that always, that something becomes homeopathy or a prescription is homeopathic only when it is potentized or it is diluted to a state where no actual substance, no actual original starting drug material is present in that dilution. Then only it's called a homeopathic preparation. Because if something is present, then that's not a homeopathic prescription. That's just a crude pharmacological action that is expected when we are giving something. So when Dr. Hammond was trying to bring this explanation along with homeopathy to explain the actions, here Libin was rightly explaining or rightly refuting the whole subject itself. So the moment when it was refuted, the next response was that what if we give a medicine which is below 12C, like 6C or 10X or 5X, whatever it be? The answer to that question is that all such potencies below 12C is not homeopathy. It's just crude pharmacological drug. The action which is happening when you administer any of those drugs to a person for any of the diseases, those actions are not homeopathic action. They are just crude homeopathic pharmacological action, and you need no homeostasis or any such explanations to explain why it is working. We have clear-cut answer today, that is biochemical action. So now comes the second part. What if the action which we observe above 12C, if at all something happens, we know that there's no such action which has ever been recorded to prove that homeopathic drugs do act in a body. We don't have such action. So even without such a proof, we are trying to say that, people are trying to say that homeopathy is effective for some diseases, and the reason might be, could be, or it have to be homeostasis. These are the expressions used. So the problem here is, as Libin explained, homeostasis is a biphasic dose response. So in both the case, in the both phases, we have two kind of doses. One is a low dose and the other one is a large dose. But when you come to homeopathy, the problem is homeopathy is zero dose. So if you are saying that it's homeostasis, you need at least a low dose. It's not zero dose. Unfortunately, the problem is very clear, that is, homeopathy is zero dose. So with zero dose, you cannot expect something to be getting an effect just because of homeostasis, which is a no effect. And we call it a placebo. So that's what exactly explains homeopathy instead of hormesis or nanotechnology or any such sophisticated jargons being taken up and trying to give that as a picture or as an answer to explain how homeopathy works. There's no use out of that. We have clear answers, and that is placebo. Hope that clears it. Thank you.
Hemant, so again, the first question still stands there. When you say you want to go with your own way of research or the current research approaches to homeopathy was wrong. The first question was, when you're giving a medicine, you need to find out the active ingredient. And if it's arsenic album 30C, for example, there's no way you can find out what you're going to give to the patient. Is it some sugar candy or something else?
Avi sir, can I have a question?
Do you have anything more to add?
I don't think so.
I mean, I think we
Uh,
can move on.
Abby
Yeah.
sir,
We
can I
can
have
move
a
on.
question?
We have to. I think we can
I
go
think
go to Dr. Nitesh. He's
Yeah.
next, I think.
Hey, Dr. Phillips. Thank you, everyone. Hi, I'm Dr. Nitesh. I'm a medical doctor. Thanks for allowing me to speak. First of all, I would say, that I respect our traditional practices. We should be proud of what we did in those times. But we should be proud of a lot of things which our civilization did, and we don't use that in today's practice. Like we should be. I think it's something to be culturally proud of. That our the ancient people were able to observe and do things like what they did in their time. But if they were to see what is happening in 2021, I don't think they will agree with how their practices have evolved, and they're competing with the medicine. Um, my question is I'll make another comment. I'm in US, and we are taught to respect patients' choices and allow them to use their home remedies or alternative approaches as long as they don't cause any harm. And that's the key word, like do not cause any harm, and that's what drives my practice. And any doctor should all doctors should remember that do no harm is the most important thing. And regarding the benefit, Dr. Phillips and everyone, I think it's a responsibility for Ayush and the Ayurvedic practitioners and the homeopathics to demonstrate benefit. But do you think it is important for medical community? I don't think Ayush or anybody like that would do that, to show that what the harm is, so that we actually can take an informed consent if the patient tells us, I want to take this Ayurvedic concoction. Um, because if there's like a harm of obesity or harm of smoking or harm of lead or harm of mercury, we do studies and we show that how it is dangerous to health. So if there are people taking heavy metals and their kidneys are failing, livers are failing, isn't it our responsibility to show the risk of harm? And so the doctors who they have some tools to show to patients, this is the harm. I don't know about the benefit. That is the Ayurvedic Vaidya can tell you what the benefit is, but these are the harms, and then you can decide. Yeah, this is Dr. Nitesh. I'm done speaking.
Thank you, Nitish. Before we go and answer your
Before we go
question,
to, well, hang on. Abby, would you like to
yeah,
speak on this,
yeah,
or
I will,
because I have the
we will take
EPA
that.
report?
Yeah, Nishad, 1 minute. Nitish, before we go to answer your question, the first thing what you told was there was an ancient practice that existed in India, and we need to be proud of our culture and that traditional medicine that was existing over here. Do you have any clue how Ayurveda was or what kind of a practice it was?
Like, could you explain more?
No, you just made a statement. So you said we need to be proud about the traditional medicine and treatment practices that existed centuries back in our country and our civilization. Now, would you just explain to us, do you have any idea how Ayurveda practice was?
I don't think it's possible to go back like people talk about Saint
No, no, you just made a
Emilian.
statement that you were
Yeah,
proud
yeah,
about it. I mean,
yeah.
what makes you proud about Ayurveda?
Okay. I wouldn't say
Have you had?
but I want to acknowledge why people trust that. Okay, let me. So I can't comment what happened like 3,000 years ago. But
Nitish,
but
we
to
have
answer
a
your question,
book. We have Charaka
so listen.
Samhita. We
Let me
have
let
which
me
is
let me
being.
let me no no let me answer that. I think I would answer that question. At that time, like in 1400s, 1500s, 1600s, when medicine had not been developed, and the Renaissance and the scientific revolution hadn't taken place at that time, in those middle centuries, compared to what other cultures were doing. Our cultures, what was the practice was happening compared to that at that time. Relative, I think we can be proud at
You're
that time.
wrong. You're
The
wrong.
civilization
You're
was
wrong.
advanced,
You're wrong. You are
but
wrong.
but uh,
There were
but
similar
I don't think
practices
I don't.
happening around the globe,
No,
in
but the
Greece,
British
in
the
China,
British came
even
the
in.
British came initially. Let me speak. Let me speak. Excuse me. The British came at that time, and they started. I think the 30, 40 years. This is not. I don't remember the dates or the exact, but I think for initially they were looking at it with an approach that they can look at. They can. They were studying it, and they started. I think there were a couple of institutes, and they started. I think it was 1600s or something. So at that time, compared to what available was there, I think they were looking at that. So we can be proud that at that time what we were doing was like comparable. But then modern science took off, and they immediately discarded this thing. This is not working, and we have a safer, better way. And the and I think that's when the medicine, they were like the British medicine system and the traditional medicine system got separated. But before the separation happened, there was some acknowledgement that we don't have anything better. So I'm just focused. I don't want to give any false narratives here, but I think at that time, compared to what was happening, like when Charak Samhita, I don't know those times. Like it's difficult to know like what happened 2,000 years ago and what other peoples were doing, and what was the culture. I'm talking about relative place in 1600s. Those time it was it was acceptable. There wasn't anything better. But when things improved, when there was scientific revolution, I think there was some clearly a demarcation. So but I don't know. Does that make sense?
Tony, why don't you make sense out of that?
Oh, well, it's pretty much clear that he has absolutely no clue about Ayurveda or Chara Samhita or any of the books in Ayurveda. He just made a
Uh,
statement there.
yeah, Tony, let's just go into the
People
Pumsavana
who are really
or
nostalgic about Ayurveda have never read
yeah,
their books. That's the biggest problem.
they haven't.
I just
It's
have a
Let's
one
go
available.
to
question.
Charaka
Like,
Samhita.
yeah, just
So
if you
you
have
haven't,
read at least one page, any random page of Charaka Samhita, you wouldn't never said like this. Thank you.
so you have absolutely no clue about it, and you've just made a statement out here.
I'm saying comparable.
Uh, and
Like
that
what
too,
you
and
come
that too, how
to.
it's more special than other ancient healing practices.
Yes, I'm saying comparable. I'm not agreeing with, like, I want to be
How
careful.
How can you
comparable?
compare
How
when you don't
comparable?
know any of it?
How do you
Listen,
compare it when you have no idea about the subject?
I think we should read a little bit. A little.
yeah, I think you should respect other people's opinions, and this
No,
is
I respect your opinion, but the problem
yeah.
here is you have no idea what you're speaking because you have no idea about Ayurvedic books. You haven't read any of them. And you come
Well,
here and make a statement that it was one of the best treatment modalities during that period. So I need to understand
I'm not.
how do
I
you come to that statement?
you're misquoting me, Tony. I respectfully, I did not say. I want to be clear. I would not say best. I would say comparable. Like I think
How
the
comparable?
what you
How
mentioned.
comparable are
And
the treatment
and
modalities
Compared
compared
comparable
to
with
Ayurveda?
what, Dr. Nitesh? Comparable with what?
comparable comparable in a sense that I would like, again, let me, Tony, I think this will clarify. At that time we should be proud that we were not behind, like we were not like um, like we were not, I think what was happening in North American indigenous systems, African systems, Iranian system, Urani, Siddhi, Ayurveda, those are all comparable systems, and at that time people don't have any option. So just in that perspective, like what people are doing and what people knew, that was comparable. That's all I want to make a point.
Nitesh, let me
I don't think it's
help you out.
better
Let me help
than,
you out. So,
I
is
do
it
not think it's
okay
better than any
that
system.
should we should so those at that
Saifulli,
time
you
it
are
was
not audible well. Your voice is very
Okay.
soft.
Okay. So okay. The system before was not better. I want to be very clear. I don't think Ayurveda had any insights which was anything better than other
Excuse me,
systems. They
Nitesh.
were all comparable at that time.
It's clear. Yeah, it's clear. I mean, at that time, it was a great. It was necessary. That was all we had. Is it okay to teach that same text today and make it a system of medical practice? Is it okay to
Absolutely
do it
no.
today?
No,
Is
no.
it justifiable?
Not at all. Not at all. I think that this is the risk that should not be in medicine. Like in US, you cannot get a herb. Like there's no the risk is too high. People losing their lives, liver failure. The risk is just too high. So I would not consume anything. I would not recommend anybody to take. It's just it's I don't think it should do. It should be treated
But
as
we should be
modern
proud. Yeah,
medicine.
that we should
Yeah,
be very
we should
proud
be
of that.
proud, but we should leave it at
So
that and not use it. Like we
you,
can be proud of
you
Taj Mahal also,
yeah.
but we
So
can't leave it in that.
it's
Okay,
something that should
Tony,
that should
let's demonstrate some of the pride with that Bala Praudha Vruddha statement. I think that will.
do you know that,
Yeah, I
Nitesh?
mean, Dr. Nitesh, I actually, I don't think you actually have read Charaka Samhita, Susruta Samhita, Ashtanga Hridaya.
It
I
would
mean,
help
many
me,
of
Dr.
our,
Phillips.
including myself,
No.
many of
Yeah,
the speakers are actually, we have read it many times over. Not because we want to, because the Ayurveds told us, read Ayurveda, only then you can come and criticize us. So we did exactly that. And I think probably I'll never get those hours and days and weeks back. It's like a dark void in my life, reading Charaka Samhita and Susruta Samhita,
Abby, it's
because
us,
it is,
us.
yeah,
It's all of
I mean,
us.
it was mentally, yeah, I mean, me and Tony, we actually have classes on it. We take classes on this every week in the Science Brigade. It's another group that we have. So coming to
And
the point, It's
And hang on a
not.
second. Hang on a second. One more thing. One more thing I need to really clarify. Dr. Nitesh, you mentioned we should be proud. Why should I be proud? I'm not part of this we.
Neither am I.
So what do you mean by we? What do you mean by we?
To clarify, Mr. Nitesh told that at that time we should be proud. At that time, there were no we, Nitesh. I think you were a part of a different so-called country, as you define country today, and I was part of a different country. And Charaka apparently was a native of Kashmir. So who should be proud?
We were. I was. My great great grandfathers were bandits, like pirates. So why should we be proud? We were doing pillaging.
Yeah, so that's the whole point. This pride is what makes people lose their rationality and logical thinking when it comes to pseudoscience. And Nitesh is a perfect example of it. Because you don't have to be
Uh,
proud of something that is actually
yeah.
pseudoscientific.
Uh,
You should
to,
No,
actually critique it.
Johnny, why don't we just give a small taste of, like, if we can provide an extract from Charya
no,
Samhita, that'll
no
be really great.
I will just tell him basically a traditional medicine that you said that you were proud of, where men to lead a healthy life had to regularly indulge in sexual activities with minors. Are you aware about that?
It is a textbook that endorses pedophilia.
Yeah.
It's a textbook
Can
that
I
endorses pedophilia even today.
can I focus? I think you're all getting triggered by something I said to open, like to respect other
No, no,
people's
no. So
voice.
because you
No, no,
said we have to be
you're getting
proud.
triggered.
No,
Because
This is
no,
very,
I'm not proud.
nobody's
We're not
triggered,
proud.
Nitesh. I
this is
mean, we
very
actually
Nitesh,
triggered a very
once you
good,
read,
very good
first of all,
discussion here.
like,
That's good.
no, no,
Nitesh,
listen. Let
the
me
thing
let me
is,
speak
we
before.
can
We
get
are
No,
triggered
this is
because
not
ashamed.
the
nonsense.
content
If
is
you're
so
going to,
crap.
like that, I'm making a, I'm making, I'm ris- I'm just a, I'm not commenting as science or as a medicine. Like I'm not. I'm very.
No,
I
what
raised an
you
important question
just
after
told
that.
Nitesh, I need to interrupt. You need to
Yeah.
mute. You just told that it was a traditional medicine and our culture that we need to be proud of.
Traditional practices. It was
I
not
am in
medicine.
fact
Yeah.
ashamed. I am in fact ashamed about whatever is being written in that book. Even today, many Ayurvedic doctors also feel ashamed to talk about it. Now, here you are telling that at that time it helped many people. A book which endorses pedophilia. A
Which
book
objectifies
which,
women, which
Tony,
yeah,
objectifies
like
and
we are,
treats women
where
it's
like
very.
women
second
are
rate.
used as just a
Can I
mere
answer?
commodity.
No,
A book
listen,
which
listen.
uses
In
women as a mere
listen.
commodity.
That you are at a very you are looking like we are looking in like what we are doing right now in 2021 when people in 3000 AD are going to look at us, we will look very primitive. Like in 2000, homosexuality was banned. Like Bill Clinton passed a law that marriages should be defended. Like in 1900s in US, the women couldn't vote. So
Red herring.
like
Red
history,
herring.
we cannot judge history
Tony,
like
call
that.
it
We
out.
cannot
It's a red
judge history
herring.
like that.
This is a
Yeah,
red herring.
We
No,
cannot
no, no.
judge history
This is
like
a
that.
red
Uh,
So
herring.
Dr. Mahesh,
no, this is
I'm
not a
sorry,
red
Nitesh.
herring.
Dr.
We don't
Nitesh,
have random,
it's like saying,
random.
okay,
Not a
let
red
me take the
we
same
cannot,
example. It's like saying
we cannot look
we
at
should be
history like that.
proud of
I think
our slavery, our practice of, if an American comes and says that we should be proud of our heritage as slave owners, that is exactly what somebody would say about Ayurveda today. Because the amount of anti-women statements that you can find in almost every page, around 10 to 20% of that content is completely, I mean, 80% of that the content is completely unacceptable. Maybe 20% you can take and use. I'd use, maybe, find something good about it, but the rest of it is anti-women. It's got pedophilia. It treats mental illness as caused by
Dehumanizing.
demons.
Dehumanizing.
let me
It's
and
say one
dehumanizing.
thing. Kapali made no, you
and
got you. I'm
yeah,
I
Nitesh,
I accept
Nitesh,
your
I'm even
one more minute.
surprised that we are
I
speaking to
accept your
somebody who
point.
has not even read this. I think that's unfair.
No,
We should not be.
Yeah, yeah,
no,
and
no.
basically
I
for
think
any kind of treatment,
that makes a lot of sense.
it
Kapali,
uses
I think.
just animal
Can you excuse me?
feces.
Can I make a comment? Kapali, thank you for that. I completely understand what you're saying. Like if Ayurveda is doing all that and they're doing we should not be proud of that. I take my statement back. I think you're making a completely valid argument. That should not be the way. I think you should. I think make saying words that when yeah all the practices which should not be encouraged, and by using the word pride even in a way I'm intending to. I think this is giving this is misguiding. So I think, like Kapil said, like, the white people will not say that we should be proud of our slaves owners. So that makes complete sense to me. Okay, so I take that back completely. So I
Yeah,
don't think we should be proud of
I
being.
think the mistake is that a lot of people just think Ayurveda is just herbals. It's just herbal
Yeah.
medicine. Actually, that is not. Ayurveda is much bigger than that. It's much deeper than that. And that depth, only few, I think only few know about it and understand. And that actually gets really bad. And
And I
that is
respect it.
exactly what we would like to say here. It's
Yeah.
not just the herbals,
Yeah.
it's not
Yeah,
just the herbal.
Nitesh, you don't need to feel bad. I
Uh,
mean, we've
okay.
been engaging in this with a lot of people, and what you just spoke now is what many of them think about Ayurveda. So there's absolutely nothing wrong in what you said. I mean, it's a good gesture that you took back your statement, but this is what many think about Ayurveda. Thank you, Nitesh.
I respect Dr. Phillips and everyone. You actually take time to read the text, and rather than going to the source and understanding what was said before you criticize. So that takes a lot of effort. Like you asked, like I can't read an Ayurvedic book. I don't have time, and yeah, but that does. I respect what you all do, and that like the Kapalivati said, like why we can't be proud of things which right now, like, yeah, that slave owner, and that thing immediately clicked my it got me thinking right away. But if all of you can just comment on the second part, isn't it our responsibility to to show the harm? Because that is what I think that is something we doctors need to like take
Dr.
We're
Nitesh,
doing
Dr.
that.
Nitesh, actually, the governments of United Kingdom and United States and Australia, they have already shown that it is unhealthy for human consumption. And even Kottakkal Arya Vaidyashala, they have actually put it upon their own website that it clearly states that none of these preparations can cure any diseases. It's food supplements. So openly saying that this is not medicine and this will not cure any illness. Why don't you go and check up on that? Why don't you read the statement by Kottakkal Arya Vaidishala, the largest, one of the largest, I think. I'm not sure. Even there are other medications that are not even sold as medicines but as food supplements. You cannot even say that this is medicine, and it's sold through a different customs code as groceries, not as medicines. When you export products from India, there are customs codes, so it's not actually medicine. So it's very clear. The EPA has declared that there is so much heavy metal that it is not fit for human consumption anywhere in the world, not just in the United States. So I think it is pretty.
Yeah, I think we can move on, Kapil.
Nitesh, before moving on, just two small points. The first thing is that, like, I would really appreciate if you can read some of these books, and I don't want you to read to every single chapter, but take this book and go to any random page, just like how Sanathan has just told now, and spend maybe some time to read one page in full. And since you are a person who practice modern medicine, and since you know about science, you understand the level of stupidity and the pseudoscience in the book, and also the other aspects of it, like just objectifying women and other things. My second thing is that since you say in the US, please take some time to type in your tab FDA and Ayurveda, and you will see tons of evidence which shows that FDA has found out toxic amounts of heavy metals in many Ayurvedic preparations over the time. There are papers in 2003, 2007, 2015, even in 17. They have found this from Ayurvedic medicines, and hence there are strong regulations of not to use it as a medicine. And in fact, they warn that these are harmful. So that's also one more thing I want you to do. That just take a tab and type FDA and Ayurveda, and
Levin,
you will find a lot of body of
Levin,
evidence.
no, listen, I know all about that. I know about the heavy metal. That's what I was trying to say. That it's not used here, so I don't see patients who are coming in with liver failure or kidney failure or damage due to that. I'm saying that, like India, when this is happening and actually patients are losing their lives, shouldn't we show the actual damage, not just like the theoretical damage, like the harms, but people who are dying or people who are being, but can't they be like any? There needs to be some
So
studies to show how the damage, like actual damage, which is happening in India.
Dr.
so
Nitesh, I would like you to visit my PubMed and see all the publications on Ayurvedic herbals liver toxicity in various patient groups, which I have conducted over the last 5 years. And there is a lot of data in it. a lot of it. I actually my group is the one who wrote about on how to manage Ayush liver injury as part of the Asia Pacific Association of Study of Liver guidelines also. So we have a lot of data. It's just a matter of going into the net and just looking at it. And this is what we are actually trying to get the public to understand also.
Actually, I'm also a bit
Are
confused, Nitesh, because
are there
in
national
the
umbrellas of these bodies? Like, are you associating? Like, is there any like pan India presence for doctors to refer to?
We don't have a good centralized system for capturing herb-induced liver injuries in India. We don't even have a proper drug-induced liver injury network like what the US has in the form of DILIN. And that's not a fault at the ground level. It's fault at the regulatory level. Even though we have a pharmacovigilance program, it's as good as dead. So a lot of things to be handled, and I don't think at the doctor's level or at the patient's level, what we can do is make them aware of such things. But the regulatory framework should come from above.
So, Dr.
I,
Nitesh, I'm a bit confused because when you came, you kind of expressed like, we should be proud of all this, and now you're concluding saying that these are harmful, and hence why don't we do something about it?
Okay, so
So, is it like, are you
let
flipping
me.
on your argument, or
No,
like I
no.
don't?
Proud like as a history, so that was a historical thing that I was proud of my of what India in general, not Ayurvedic in particular. So I'm not flipping. I honestly, that's what I like. You listen to the first two statements, but I'm being after that I only said like it's do no harm. These medicines, the herbs can lead to like dose dependent idiosyncratic reactions, liver injury. I just had a friend whose father needs who's on dialysis because he refused to manage refused to see a nephrologist and just took Ayurvedic medicines from like a national recognized company, and now he's on dialysis. So just the harm I see all the time, and I keep a close eye on my parents so they don't end up taking any of these supplements. Food supplements is a misnomer. It's not food or it's not supplements is a danger. So no, I believe that. So I think, but I'm saying what we are taught is to integrate these things if we can without if we know that there's no harm, and that's what if we do studies more on harm and then the harm is clear, then it becomes a no-brainer. Like we can tell patients, I don't know the benefit, but there's a lot of harm, and this is what is proven. You can look Dr. Phillips studies or some others or some regulatory, like these are the damages you can cause. So I don't think as a doctor I can justify recommending you continue using that. So it just makes it more stronger. That's all I wanted to say.
all right,
And
Elizabeth.
Nitin, basically the first part was just appeal to tradition. That's all. Nothing more than that.
Elizabeth,
Libin,
please
I
go
think
ahead. Tony, one second.
Elizabeth.
He's flashing. Yeah.
Yeah,
Eliz-
Nitesh, I'm a bit worried about your second statement. The second statement that you made, which said that you were talking about the U.S. and you said the doctors say let them do what is. I'm just steel manning you to see if you said that. Let them do anything as long as it's not harmful. But how does the doctor know what sort of natural thing the patient is going to do, which is not harmful? How can they say that? And
Excellent
one more
question.
thing, just one more.
Yeah.
I'll add one more thing. And I have always wondered this about the U.S. And Europe, why they don't raise why they're not aggressively protest, why they don't aggressively protest against Oriental medicine and things like that, why they allow it, although they don't allow it to be classed as medicine. They do say that it's harmful. They do all that, but they still allow it, as in they allow them to have these sort of holistic medicine clinics and whatnot. So I have always wondered if the reason behind that is just simple cultural appropriation that you see in every other area which concerns immigrant communities. Like anything that's Oriental, anything that has any kind of non-Europe origin, to take a strong stand against it. The reluctance to take a stand against these things. To do the necessary part of it, but not going out of their way to say that this is rubbish and you shouldn't be doing it just because it's Oriental and it's supposed to be whatever. So do you think it's a form of cultural appropriation that they don't take a proper stand against these things? I mean, not the stand right now is not enough. They do allow these things everywhere,
Yeah, no,
knowing very well it's useless.
Okay, that's a great question. I don't know if you've been following
And, and, I, and
anti-vaccine
I think
debates.
the first question is what I mean. How can a doctor say that to a
Okay,
patient as long as it's not harmful? How does the doctor know what the patient is going to take, and how does the doctor know if it's harmful or not?
yeah, I agreed. We most of the things which we patients are doing, we don't know. Most of the time, it's looking. So it's not like we can't say it's harm. It's actually the discussion is like if I know like there's certain therapies which are used often in US and the FDA has shown what is the harm is. So most of the time, if I've been showed like 3 products out of like 10 products, 3 out of 10 I would 7 I would say I don't know, 3 I would be able to tell them that there is harm. So I would say either there is harm or I don't know. As a doctor, and I would never say that there is no harm. It's either I don't know, it's your choice, or I really know that
But
this
I'm
is.
sorry,
Listen,
Dr.
let
Nitesh.
me.
Nitesh, I'm
Can
so
you can
sorry
you
to
can
interrupt.
you
I need
complete
to
my thought?
interrupt you. I'm so sorry. I need to
No,
interrupt you. It was my question.
I
It was my
and I'm telling you
question. I
why
have
we
to
do that.
interrupt you. No, no, I have to interrupt you because it's your first statement said it's always said they say that if it's not harmful, go ahead with it. You said that. You did
No,
say
so I
that.
think go ahead, like okay. So like I'm trying to clarify here. Can you let me speak here?
Yeah, I will let you speak. I just want to
Yeah.
be sure that we are on the same
I
page. That's why I.
all right. All right. So like as a practicing physician, like the doctors who you actually practice, they would understand that we can recommend things, but patients would for patients to be compliant, we have to choose our battles and that's what the American culture is like. We can't make patients do whatever we want. We have to give them the advice. And if there are a few things like if I have evidence that this is causing harm, I have a stronger ground to tell them that this is shown to cause harm, so do not take it. But if other things I think they may cause harm and we say that it is harmful, then it becomes like opinion. So that's what we have tried for to keep our views objective, for patients to believe us. We want to tell them when we know there is harm, and when patients are doing something which we don't know. I won't say like it's not like we allow it or not. Patients are going to do it anyway. So, but we ask you specifically, am I taking this herb? Should I take it? I don't know. Or you can say, oh, this herb clearly has shown a risk of damage, so please do not take it. So only those two responses are acceptable. Don't take it because I know I have evidence, or I don't know, it's your choice. I can't really comment on that. But if we keep saying like if we just make a comment without evidence, then patients stop listening to us. So that's I think that's the reason why it's just to be able to work with patients, just so that they can
Dr.
trust us as
Nidesh,
an objective. So
can you please pause? We can stick on the topic, okay? Just move on. Who's next?
So I just wanted to clarify something. Just because we are now discussing about harmful effects and toxicity, I just got a message in the back channel, and this was somebody who was not in my list. I'll just read it out loud. This was from a person named Advait BG, and his comment was the following. So you are saying no toxicity in modern medicines? Question mark with some laughing emojis. What nonsense you are telling? So I tried to invite him, but unfortunately he's not there, I guess. So let me address what the point is. So we have been pointing about the toxicity of Ayurvedic medicines for the last 3 or 4 months, with based on published evidence. So where exactly is the disconnection? Like, are we? Did we ever make a point that medicines used in modern medicine is not having toxicity at all? Actually, not. The thing is that the medicines we use in modern medicine has been gone through rigorous testing, and we do have a dose depending upon the whether it's a pediatric dose or the adult dose, and we do know that what is a safe dose at what time of intervention and how it's gonna be good. So if anybody's taking a modern medicine, they can actually check it up themselves and find the whole details of what is the drug doing. Most likely they have a mechanism of action, what exactly is the recommended dose, what are the drug interactions, what is the problem, what you should not be mixing together, because there are some drugs which can actually be confounding with other drugs when you take the same time, and what are the possible side effects, and how to manage these side effects if you have. So there is very clear recommendation and evidence on that. When it comes to Ayurveda, there is zero, again listen, there is zero evidence on anything, especially in classical Ayurveda. There is zero evidence where you can find that this is the drug or this is the preparation or this is a herbal mix, these are the ingredients, this is a possible mechanism of action, this is a dose. Nothing. Zero. So that is exactly we are trying to raise out. Like, you are taking an assumption that just being natural, it's going to be, or it's being herbal, it's going to be protective, or it's not having any side effects, is what exactly we are calling it out. So the person who sent me this back message, Advait BG, my response to you and all for the other people in the audience is that we have never made any claim that there is no toxicity in modern medicines. In fact, we are well aware of it, and hence we know how to manage it and regulate it, and how to do that. What is completely lacking in classical Ayurveda and also to some extent proprietary Ayurveda is we have absolutely no idea about anything. You cannot find information about this in any platforms or any bodies. And further on that, this is the same reason why Ayurvedic medicines cannot be sold as medicines in US or in UK or in European Union, but just as only food supplements, which has a totally different regulatory mechanism of selling something, which is very different from medicine. Okay?
I've kept the hand raising options open. Advait is there somewhere down, and if he wants to come up and say something about it, he's always welcome. We can move
Yeah,
on to the
I
next
invited
person,
him,
Abby.
but he's not come up. I invited him. I think
Yeah.
Sumesh, are you there? Sumesh has been here for a long time. Sumesh, would you like to
No,
say something?
there was somebody before that. Manjunath. Manjunath was
Yeah.
here initially, and then Manjunath, are you audible? Nitesh, if you're done, you can please move to the audience. Manjunath.
Yeah, there is some technical snack. Even the previous time also it happened. I just had two questions. I have a patient who is waiting in emergency. One is about Institute of Advanced Dermatology, which supposedly practices some integrative medicine for elephantiasis. So this is what the Ayush pseudoscientific people claim, that integrative medicine is the future. So they just give this one example that they have combined modern scientific medicine with Ayurveda and they're treating elephantiasis. Because I don't reside in Kerala. This happens to be in Kasargod. So I don't know the exact picture what is happening over there. If you have any idea, you can address it. Second thing is the problem with Ayush, the recording the adverse effects of Ayush is that there is no proper channel. Even though there is some pharmacovigilance happening, supposedly happening, there is no proper channel. So can we create an app through which every doctor can prescribe, whether he is Ayush or whatever, for modern scientific medicine doctors also, so that they prescribe through the app. Wherever internet is not available, they can prescribe handwritten give out handwritten prescriptions. But otherwise, if internet is working, we enter the patient's ID and then prescribe, so that Ayush medications are also recorded. There is, because there is no record of who prescribed what to whom and on what basis they prescribed. There is no record of Ayush, the side effects of Ayush. This is why Ayush is still continuing to be practiced in our country. And probably, and third question would be, what is useful today, if at all, if anything is there from Ayurveda? These are my three questions. I'll listen to the answers in the recording subsequently. Thank you.
I can go on the last part of the question. Is there anything we can take from Ayurveda? So we already discussed over the time that the fundamental principles in which Ayurveda is laid, which is a Panchabhudam and Tridosha, is utter rubbish. And there is no way to explain this today in terms of what is happening. All the three different categories of Vada, Pitta, Kapha and everything is absolutely absurd. So the way they diagnose, the way they find the reason for a disease and the way they treat diseases are all out of the equation. And the book has a lot of, as we mentioned, objectifying women and all other casteism and all other issues. So what is left to take over? So I don't know, after all this has been taken out, can we first even call that thing Ayurveda? But if you still want to call that Ayurveda, the only thing which is probably taken care is take all the crap out of that book and probably do some data mining, not even do research on anything to find what is in the plants, because that is already been done. We have a detailed pharmacopoeia of what are the different ingredients in different plants. What we need is proper data mining, where we can look into some of these ingredients and potentially do some MD simulations, which is one of the first thing people do in drug discovery, to see whether there is a possible interactions with some proteins or interaction partners we have in the system. And from there, we might have possibly some lead molecules, which could be potentially studied by synthesis, modification, and some extraction methods, and see whether we can find anything on a preclinical level. So this kind of research is something we are also trying to say, like, rather than spending money to identify what is there in a polyhybrid combination, first go back to the literature and check the lead molecules or potentially lead molecules from a bioinformatics standpoint, from a modeling standpoint, and come forward and see anything can be potentially useful, because that's the way how classically we do drug discoveries, not only just from plants but also from other sources. So that's the only thing. So, but I don't know whether we can still call this as an Ayurveda, because once the foundation principles are wrong, once we already know that the way they diagnose and treat is again fundamentally wrong, we don't have something called Ayurveda. We can call it by any name if we want, and then that's the only thing we can do at the moment. What is left over to take from this, which can be potentially beneficial for some ailments. Thank
I'll come to that first part where it was mentioned that integrative medicine. So I think it's very important for a lot of people to understand. I think it's maximally utilized in oncology, in treatment of cancer patients, and also in orthopedics. And I think in some areas it's actually going into dentistry, plastic surgery, and a lot of these areas are being targeted by something known as integrative medicine, where the patient actually gets completely treated in a modern medical setup by a surgeon or a physician, gets the complete science-based diagnosis, treatment, management, and everything. And then during the recovery phase, Ayurveda or homeopathy or even Siddha or yoga or even naturopathy enters the scene. And it's like once they enter the scene, it automatically becomes the safer option. That's what people think. Ayurveda is natural, safe. Siddha is natural, safe. Traditional medicine is safe, and the whole work is actually done by the scientific medicine. And once the patient recovers, they say that the integrative medicine actually helped, not medicine, but integrative medicine. So this is the biggest fraud that is under play here. If you look at one of the recent publications on Ayurveda use in COVID by the Ayush Ministry, which they have been actually putting up all over the internet. You can actually see that the drugs that the Ayush Ministry gave, or even the Ayurveda practitioners, they give Ayurvedic treatments for COVID. The drugs that are being given are actually given along with proper medicines. They take paracetamol on the side, they take maybe steroids on the side, they are inside a proper hospital getting the treatment there. Then an Ayurveda physician will call them on the phone and say, take some tulasi inhalation. That it becomes integrative medicine. And then the whole center of gravity changes towards Ayurveda. Ayurveda was used along with this, and Ayurveda cured COVID. So this integrative medicine is the biggest fraud, and this actually happened during the pandemic. And this is for everyone to see. You look at any COVID publication properly, from Ayurveda point of view or homeopathy point of view, you can actually see that it's all been done under covers. Alone. If you look at Ayurveda alone, if you look at homeopathy alone, it does not do anything for COVID. Forget about COVID, any infection, any cancers, any injuries, nothing. So this is very important for you to understand. Integrative medicine is a fraud, and one should not fall for it. And that is what the first part of the discussion was on.
Did we miss any points, Manjunath? You had a second point, right? Like, did we miss anything? I think
Uh,
if you think that we
he
have covered most of it, then we can move on.
he said he went to. I think he went to he was attending an emergency case.
He
Sure,
can
sure,
come back
that's fine.
anytime. We can move on, Abby. Who's the next
The
person?
next is I think Vipul.
Rahul.
Oh,
Rahul is there. Rahul, did you speak?
I see Mr.
Sorry,
Shree's moved.
my bad, Rahul. I didn't see you. Sorry, my bad. Please.
Okay.
Yeah. If you may, Rahul, if you want to go first, go ahead.
Thank you, Simpson. I see you ahead of me. Anyway, I'd like to give my 2 cents on the topic. And I would like to give that in the context of this ongoing pandemic itself. So, reading out the headline, "The Benefits of Teaching Pseudoscience in India," I think is that, India becomes that country which first receives the pseudo preventives and pseudo medicine itself, like the virus killers. To make that statement clear, like one famous person once said, we need to understand the chronology, the chronology of events. Event number one, what I remember is during the early stages of Corona, during the pandemic, they came up that somebody released a preventive medicine, in quotes, preventive medicine, medicine which prevents a disease or a ongoing event, which eventually became a immune booster. The moment we realized, the science community or the citizens realized that this particular so-called medicine will not prevent anything, it was rebranded as immune booster. And that event was regarding this homeopathic medicine. Then post that, the pandemic shooted up, the numbers shooted up, and there came another medicine, Coronil, right? The famous Baba released it, and he even made an intemperate remark that, look at your science, the modern science. It is stupid science, in quote, right? Which eventually the health minister, health minister has to come back and say at that time has to come back and ask him to please take it back, right? Then event number three is from the health minister himself. He has to, he said that there are benefits of yoga, for mild symptoms of COVID-19. It's kind of giving a very nice but very false sense of comfort to people. So you look at all these events. To conclude, what I have to say is, indigenous knowledge is okay. To go back and trace the history of what it is fine. But as long as we know that there is only one science, right? H2 plus O2 becomes water. That cannot change. There is only one science. As long as there is only one science, and when it comes to medicine, which cure diseases, save lives, please keep the tradition, your nation, your pride, everything should take a backseat. Belief due to your tradition, but the pride should take a backseat, and something which has nothing to do with belief, which is evidence-based science and evidence-based medicine or whatever in that particular regard, should come up and take the front seat. Thank you.
Thank you, Rahul. Shinsuban.
Yeah, nicely said, Rahul. And once again, a big applause to the organizers here, doing a wonderful job. I want to start with an opening statement here that, uh, to go with the title. And if that is phrased as a question, my answer would be there is no use in teaching pseudoscience in the context of health science or any sort of science. Then to bring it into a little bit of focus towards health science, we could start asking a question. Then what are we doing here by letting them continue, or what are we going to do by letting this alternative medicine practitioners continue their practice? So if you go back in time, we initially thought that these are harmless and thus let them continue their practices. But there are two problems with it. I see mainly two problems with it. There could be more, and many of the speakers here have highlighted those. So the two problems. The first one, by letting them continue doing their treatment, is when a patient approaches this branch of alternative medicine, and while they are getting treated, in fact, their access to a proper medical treatment that would probably improve their quality of life, probably, if it's a curable disease, that would probably cure the disease, and such chances of such treatment or getting to those treatments are getting delayed. And I think that should be criminal. That delay of treatment or delay to access proper treatment should be criminal, because the individual could be back to living their normal life, and by holding them back in an alternative treatment environment, you are delaying it and thus doing injustice to that patient. Second problem is the first statement I made, like where these are probably harmless, but now from extensive amount of evidence, including work of Abby Phillips, have shown that there is serious organ damage, especially hepatic injury, and so letting them continue this practice is not feasible, mainly for these two reasons, because those causes damage. Second, even if it's in context of alternative therapies that do not do damage, you are actually delaying access to a proper treatment. So both are indirectly or directly doing harm to the patient. Now, what can we do then? How we overcome this? So I find it difficult to come up with approaches on how we can overcome the existing practice. My thought is probably we should start educating younger minds even at a school age and develop their scientific temper and educate them about the evidence-based medicine as well as this alternative therapies. So probably through a counseling session once they are at the +2 stage in Indian schooling education, so that they are aware when they choose these branches, so that they can make an informed choice and say, oh, this is what I am getting into, and probably this is not a good thing to do for my lifetime. Thus, probably we can reduce the number of practitioners over the next few generations, and probably this would become extinct. That's my thought. I'm Shinsman. I'm done speaking.
Yeah, people.
Hello all. First of all, thanks a lot for organizing such an informative session. And my question is, here, all are the modern medicine doctors are speaking about both the pathies, but can you able to invite anyone who is practicing Ayurveda or homeopathy, and they can like counter your opinions or anything like that? Can this is possible in this club? Because this is very interesting
The hand
conversation.
raising
That's why I'm
option
asking.
is open. Anybody who wants to
We
challenge can
will.
come forward.
We have a practicing homeopath here. His name is Dr. Pudwal. He's now in the speaker list. We also
Okay.
had a not practicing, but a homeopath who left practice, Dr. Arif Hussain, who just went down because he has some inconvenience. So if you
Okay.
want to ask something, you can ask to Dr. Pudwal. He's next to you.
Like I don't want any I don't want to ask any question to any doctor. I'm just suggesting this, like in
Yeah,
Kerala there are many famous doctors
that's
who
what
is
people.
practicing.
The hand
Yeah.
raising option is open. Anybody who wants to
Okay.
challenge it can always come forward. We haven't stopped anybody from entering onto the speakers panel, so it's
Okay.
open.
Okay.
Yeah.
Okay. That's my only questions. Thanks a lot.
To come or not is up to them.
Okay, thank
Should we
you.
move on to the next speaker? I think it's Dr. Podwal. Podwal is next on the line.
ഞാനിപ്പോ എത്തിയതേ ഉള്ളൂ. നിങ്ങളൊന്ന് സ്റ്റാർട്ട് ചെയ്തിട്ടാകുമ്പോ ഞാൻ അതിൽ പങ്കെടുക്കാം.
Pudwal, this is being conducted on English because this is going on YouTube. So, if you don't mind.
Okay.
Okay, next on the list we have is Busher. If I'm pronouncing it right, Busher.
Yes, yes. Am hello? Am I audible to
Busher.
you?
Yeah, now you're audible.
Yes. Okay. Thank you. No, I have two clear points. One that one speaker was pointing. Shins Mohan was pointing to start educating people and to start all these scientific temper and all these things in grassroots level. But since I am from the education sector, very unfortunate to mention that no such actions are being taken either from government side or from any community level also. Rather, I should say that when children are taught like that, you eat fruits or don't eat what so-called hormone injected chicken. to avoid menstrual problems, something like that. Very unscientific way. Nowadays, the syllabus is rolled on. So, in that way, we can't expect even to develop scientific temper and all in present day scenario. Next one, more dangerous thing what I felt is that putting these all homeopathy or allopathy, whatever may be, putting in a disguised way, rather putting it in a direct way, saying that this is homeopathy, rather the community who are following or practicing this homeopathy is always nowadays putting in a disguised way that homeopathy plus somebody was speaking about that like integrated medicine, something like that. So both way it is very unfortunate. Like we can't even expect any improvement in this. What I can say, all these happenings. That's all.
Thank you, thank you. I fully understand that at the grassroots level, the attempts are low, and that's one of the reason people are still confused. Mainly because it's first approved by the government, so that is one of the first thing. If there is nothing there, will the government ever approve this? The first thing, and second things, people have anecdotal evidences. These are the two things by which today also pseudoscience survives, whether it's in healthcare or any other sector. Usually, whether what's the regulatory affairs related to that in terms of approval and education, and second thing is anecdotes. So you're totally right. In the grassroots levels, the efforts are lower, but there have been a lot of momentum recently to make people more aware, so that people who are not able to get a proper seat in MBBS, for instance, they think twice before even going for alternative system of medicine. So there is some momentum, and let's hope that this continues. And also the people, especially in the politics, people who are lawmakers, they also kind of recognize some of this, because we are at the moment like literally swarming in pseudoscience in every sector. So yeah, there is a change happening, but it's quite slow. The only thing we can do at the moment is, like, make people more aware of this. Many people were not aware, and as we keep on discussing and this becomes more general to the public, and when they meet an alternative practitioner, they ask questions, and this is all good change which is happening. And the COVID was a good example, a prime example, to look at that. Like, only evidence based, science based things have been used, and all the alternative systems has been just been fully paralyzed, really exposing their the pseudoscience in them. Thank you. If Bashir, if we're done, maybe I'll go to the next speaker, who is Rajesh.
Yes, yes, yes. That was all my point.
Thank you.
Yeah,
Rajesh, you're next.
yeah, thank you. So I had a couple of points or comments. One is that in the pseudoscience discussion, probably one thing that gets missed out, which I see in my circles, is this whole idea of nature cure. That you should not take anything, and everything is a placebo, and things will be fine if fever is a good thing, and this elusive toxins and all that. So probably some discussion on that and allied aspects of it. I think that will also be very good. The other was again this science education, right? So I was just thinking, if I see a lot of content on Twitter, but can there be any kind of knowledge base, the way the alt news exists for political and other kinds of news, something which is curated, very well curated, which we can share? For example, somebody is recently this evening was telling me about aloe vera and how it cures everything, right? So something to support, or some some reference or something that I can share about clinical trial and everything else. So something like that, if we can create a knowledge base which is accessible for citizens, not the peer-reviewed journals, but which is dumbed down for somebody like me, I think that will be fantastic. Yeah, that's it. Thank
Thanks.
you.
Thanks, Rajesh. I can maybe comment on the second part. So we have been trying to build a database where we can actually put on all the links. Like for a vast majority of things in homeopathy, it's thoroughly debunked. So all our effort is to just point to the evidence. So that is
Right.
pretty straightforward. And regarding Ayurveda, there have been a lot of evidences again in terms of injuries, in terms of regulations, in terms of toxicity, which also we can put. But the biggest challenge is that, like, even the peer-reviewed process, unfortunately, is not 100% perfect, and there have been flaws in the peer review where there are some journals which has published literally BS bullshit. So this is a monumental task where it's a huge effort now to not only write rebuttal letters but also point out the real problems in these studies and why these studies are not actually right. It's not done in a proper scientific or rigorous manner. But we are still making an attempt to build a database where people can actually go and check all this so that it's more available to public, because actually this should be something which government has supposed to be doing, right? Like in, for example, in most countries there are strong government agencies. Like, I live in Canada. There is a page called Health Canada, which actually provides most updated information about COVID, about vaccines, about treatment opportunities, and they really want their citizens from what to take and what not to take. There's the whole hype about something called ivermectin, which is used as an alternative or like a treatment for COVID, which has been debunked by the government officials itself, both in the FDA and also in the Health Canada pages. But unfortunately, in our country, we don't have such a system, as I'm aware of. Maybe there is something. If I'm wrong, please point it to me. Where the public should be easily be able to access this in any language they want and get more facts. Another important problem is also that at the moment, the mainstream media, which we'll be addressing in the coming sessions, is also completely in like pampering and in favoring pseudoscience, and they don't really have a scientific panel of journalists who actually look at the data and write columns or articles in the more scientific manner, but mainly it's more to generate headlines which are more toxic, more fear mongering, and completely twisted facts and data. So these are really monumental tasks, but we are making some effort to put a database together. If someone else can answer the first part of Rajesh's question, I'm done speaking.
Probably I can add on to the second part a little bit more. There are some good international resources. Just want to mention a few books and a few websites. So I think one of the important book is called Skeptic's Guide to the Universe. So it is a book written by one of the neurologists in the US called Stephen Novella and some others. So it kind of elaborates on different pseudosciences and how to differentiate science from pseudoscience. And that's a really good book. And if you want to look at just the medical science, there is a writer, UK writer called Ben Goldacre, who is a physician as well as a scientist, who has written books on how badly conducted studies influence practice. So this is not just about alternative medicine. He has also written so many articles about like practices in modern medicine that are not based on evidence. So there is a like lot of allegation that the modern medicine doctors don't talk about their practice, which we actually do. So there is a book called Bad Science, and there is another book written by him called It Is Much More Complicated Than That. So all three books are really good. Talking about websites, there is a website called thinkingispower.com, which is written by one of the biologists in the US, which talks about how bad our thinking process is, every human being's thinking process is, and how we can be easily fooled, and how can we improve critical thinking. That's called Thinking is Power. There is another website called thelogicofscience.com, which very well explains the logical fallacies, our confounding factors, and how the science and the research is done in a very simple language. To mention it once again, it's called thelogicofscience.com. And to talk about the medicine itself, there is another website called the sciencebasedmedicine.org, which is also a very good website to look for issues related to just medicine. Thank you.
Yeah, thank you. Just one, if I want to add on, see, one thing that I see is the people we are looking at, my neighbors, my friends, some of them educated in what we call as modern science. But for some reason, I don't know why. Probably one reason is that pride gets mixed with science. But for whatever reason, if we can have something which is accessible in the form of FAQs, right? The same messages keep circulating. The same BMX videos, the same set of things keep getting circulated. So some corpus, if we can build, which is sustainable, I feel that will be fantastic. I've made a note of these books. Thank you so much. But I was looking at something in the genre of something that, for example, Pranav does, right? Something like that, but a text-based form. But yeah, thanks. This was very useful.
I think like we can go and check Dr. Poduwal once again. If he is free, he can speak. Otherwise, we can move to Dr. Shantanu. Dr. Poduwal, are you there?
Yes.
Do you have something to add? Like,
Yes. I'm checking the heading benefits of teaching pseudosciences in India because there is a space for pseudoscience in India
So what is the benefit in that? That is the question actually.
because people benefited by what you people call pseudoscience.
Any specific pseudoscience that you want to discuss on how it is beneficial?
No, nothing
Then how do you know that it has benefited?
because I saw
No, which
people
pseudoscience are you talking about?
that's I confused. So I check it.
No, you said people have benefited from pseudosciences. So I would like to know which
So
pseudoscience
that
you're talking
existed.
about.
So that existed.
Which one?
Anything existed in the world because there's a space. There's some people benefit.
Yeah. So in which kind of pseudoscience is beneficial according to you?
That's I checking.
Now, you made a statement, so you should always have something to back it up, right? Checking as
Yes,
in Google.
checking.
I think what he said is correct. Some people are benefiting. We know
Yes.
those who are practicing pseudoscience are benefiting.
Yeah, I think that is what he meant to. Is that what you meant, Dr. Podwal?
That's not a mandate.
Yeah. So I think, I mean, because you made a statement, I think it is always good for the audience that you can maybe clarify it for us.
can you name a few pseudosciences? You said it's anyway, it's beneficial for some. So if you can name a few pseudosciences that you can just, that'll be really useful.
No, so I checking your discussion. What are the pseudosciences you mentioned here?
How
I
about
mean, what are the
homeopathy?
pseudosciences that you know of that you think are beneficial? So it's an open discussion, no?
Okay. Actually,
Take, for
redefining
example, you can pick anything from Ayush. It's a pseudoscience.
I
there are many
think, Doctor,
pseudosciences.
if I can add on, I think what Dr. Podwal is trying to say is that although we are saying that all these alternative practices are pseudosciences, he could see people who claim that they are benefited from it. Is that what you're saying?
Yes.
Okay, so what we are trying to say is that all these claims, they don't have a scientific basis. There are like multiple varieties of reasons for people to think that they have benefited from it. So these are the things we are trying to explain, that these are not valid reasons or they are not actual benefits, and there are like varieties of reasons for people to think that they have benefited when they're actually not really benefited, and it only actually in a long term probably harms them or prevents them from going to actual science based medicine.
No.
Like
I don't.
Padwal, people have benefited from black magic and voodoo and going to religious shrines. So how can you say that these certain alternate medical practices have helped the people?
That's not correct.
See, if you go by that logic, for example, if you search for benefit of anything in the world, like for example, say benefit from carrot, and if you search typing on the Google benefits of carrot, you'll get results for everything. That starting from it cures from common cold to cancer. So it's the same with everything. You whatever you type, there will be somebody claiming that that has cured something for him. So that's not how science works. That is the reason there is a scientific method which exists, which can take into consideration all these claims and then systematically evaluate it and see if that actually helps.
So, Dr. Podwal, basically, there is no benefit. You made a blanket statement, but there is no evidence that it is beneficial. So we would take it as a blanket statement, and we would take the answer as there is no benefit. Just because there is a space doesn't mean it is beneficial. That's the whole point.
Maybe.
So I would like to just come back to one point which was made previously by Dr. Manjunath. He was asking specifically about this particular Institute of Applied Dermatology, IAD, where they do integrative medicine for management of filariasis, which is elephantiasis, the old term. So what they do is they give diet recommendation, they give proper physiotherapy exercise recommendations, medical management, and on top of that, they add yoga. Ayurveda, and homeopathy for treatment of filariasis. So this is classical integrative fraud. And if you go to that website, it's very interesting. What they do is they give complete integrative care with all Ayush streams. They even give yoga for filariasis. Just imagine. And they have mentioned that they have had great results. And then I went and saw the publications. I couldn't find any, no publications. And then they have made a statement saying that the International Society of Lymphology in the USA has written an editorial on integrated dermatology developed by this institute. So I went and checked the International Society of Lymphology. No such editorial is there. In 2005, they have presented this small case series of patients treated with yoga, homeopathy, and Ayurveda for filaria. And for that, they won an abstract award. And that's it. That was not even published. And based on that small the 2005 abstract study, they have been carrying on this integrative fraud on a lot of people. So I think it's very easy for our audience to actually identify such gross fraud practices if you just look at these websites itself, because there is no
He's a
published
modern medicine
evidence on
doctor.
this.
I think he's a modern medicine doctor. Dr. Narahari. Am I right?
Pardon me?
Dr. Narahari,
Yeah, this is
modern medicine doctor.
no, it's not a modern medicine institute. It is a integrated medicine institute, which is basically modern medicine along with lot of other pseudosciences. So basically, you take it as a fraudulent institute. So don't blame it on modern medicine. This
Dr.
is
S.R.
like,
Narahari, a modern dermatologist, I think.
yeah, whatever it is. There are a lot of modern medicine doctors who still practice fraud in the form of homeopathy and Ayurveda and all that. They all come into the category of pseudoscience only. It doesn't change anything. You
Okay.
don't have to appeal to authority in that way. That doesn't work. So you have anything more to add on that, Dr. Podwal, on integrative dermatology?
No, I heard. I saw some patients benefited by Dr. Narahari's treatment. He is a director and chief dermatologist.
I have seen some patients benefited without Dr. Narahari's treatment.
Yes.
Yeah. So what does that mean? So your experiences, anecdote doesn't matter here, Dr. Podwal, because homeopathy is full of that. And that is the only thing that you know, which is actually not true. That you should understand. And I think you should also talk in that logical sense so that people will have an idea about what you are trying to convey.
Please check his website, IAD.
I'm talking about that only. I've opened it and I'm talking about that only. It
No,
is
there are
IIT has no
many.
branches outside Kasaragod, Kerala. It is here only. In Kerala only all this integrative fraud is happening. You think we don't know about this?
No. If you
Abby,
say that, I
imagine treating filariasis with yoga, like being in an inverted posture for like treating
No,
filariasis.
I think the
It's so
only
curious.
asana possible is shavasana. With bilateral filariasis yoga, only shavasana is possible. No other asanas that patient can do.
you please check his
Probably the
website.
logic is like from
There
the
are
lymph
many,
nodes, it will flow
there are
back
many
to
photos.
normal.
So
Clinical data, many clinical data in
So
his site.
there is no clinical data. So basically,
No, please
what
check
we have
his
seen in
website.
this is that they actually give good physiotherapy. So they do something known as this venous massaging, which is actually a proper medical treatment for filariasis, chronic filariasis. And on top of that, they add these homeopathy drops and yoga and whatnot, and then call it integrative whatever, and then make it as they charge it much more, I think, than the normal treatments. And that is how these businesses run.
I don't think so.
If you know about the clinical data and publication, Dr. Podwal, please let us know author name, year, which journal this was published. We'll be happy to look at it.
Okay, I will check and send it.
Now, checking even we can do after this session. I am telling you right now because you seem to know about it.
No, I'm checking his website. There are many.
His website is
Uh,
open in front of me. It is full of testimonials. There are absolutely no clinical data in that.
Dr. Pudwal, when you come up to a scientific platform and say something like better be ready with the data. Otherwise, it's a useless exercise. That's why.
Yeah, we all trust in God, Dr. Podwal. Everyone else must bring data. That's what it is.
okay.
Shall we move on to the next speaker? Like, I don't think like we need to be
Yeah,
wasting more
it's
time
I
for
think
this.
productive that's going to come out from Puduwal.
Yeah, I think the last speaker is Rahul.
And did we miss Dr. Shantanu? He was here.
So Dr. Shantanu is here. I'm sorry, I didn't see him. Dr. Shantanu was a homeopath doctor. Now he is a obstetrics and gynecologist practicing in Maharashtra.
Hello, Abby.
Yeah, Dr. Shantanu is here. Hi.
Sorry. I took some time to unmute the mic. I couldn't find the button easily. Anyway, shall I make some comments?
Sure,
Sure,
please
sure.
go ahead.
I understand that it's time to conclude and I'll be as brief as possible. I'm sorry that I joined late and I really do not know whether these points were already made before. So I'll just rapidly go through what all I have to say. First of all, that all pseudosciences are based on a wrong concept of anatomy and physiology. They have their own anatomy and physiology, which many a times is culturally or religiously rooted, and therefore it actually does not apply to the entire species of Homo sapiens. Like you have leukoderma, which according to Ayurveda is because of some sin that you've committed in your previous life. And there are religions and cultures which do not believe in previous life. So how do they explain leukoderma for those populations? So that's a very weird anatomy and physiology that these sciences, so-called sciences, are based on. And obviously, once you get the anatomy and physiology wrong, you just cannot get the pharmacology right and the clinical medicine right. It just doesn't stand that way. Another point that I would like to make is there was an immense opportunity and plenty of arsenic album was distributed as prophylactic for COVID, but there has not even been a single paper, not even a single paper, which tells us about the efficacy of this particular so-called prophylactic medicine. I've checked the website of this Central Council of Homeopathy and ICMR, and the numbers that they show are so weird, and they do not actually they do not have enough data presented there to perform any statistical test there. I agree with one of the speakers, and several websites were mentioned by him. They're very interesting books and very interesting websites indeed, and they tell us why the human brain actually believes in such pseudosciences. In fact, it is the default pathway to believe in pseudoscience, and it is a trained mind and a trained brain which will not believe in pseudoscience and will come to scientific conclusions and use the scientific method. So critical thinking needs to be taught separately apart from science itself. It is the method of science that needs to be taught. So I would urge all of you here, because I'm sure that there are a lot of minds here who are trained or have trained themselves in critical thinking, to write about your own specialty like Dr. Abby does and so many others do. But then rather than just writing about the as a bit of information, concentrate on the method of science as well, and how this information was brought up and what efforts went into coming to the right conclusion. I believe that this will also be one of the ways in which you train your readers into critical thinking. Another thing that I would mention is that pseudoscience happens everywhere and is not restricted to so-called alternative medicines. Even modern medicine has its share of pseudoscience, and we should also be mentioning, focusing, and talking about it, so that we are never blamed of saying that you have a bias against the traditional or cultural practices. The question that we often face is, what is the harm? And then this must also be, what's wrong if I take, at least there is nothing, no harm will come to me, which is not the correct line of thinking, because we all know and we should be putting forward examples of patients who have worsened because of use of pseudoscience, patients who have been kept away from rational evidence-based medicine because they fell in for some pseudoscientific management. We must also understand that modern medicine has a lot of preventive interventions to offer. In my area of specialty, I would say that a pap smear examination is something that no alternative medicine system actually can ever think of. So the patients are weaned away from such prophylactic and preventive management. And of course, everything that the pseudoscientific practices do, they do because of a wrong pathophysiology. And once you accept something to be the reason of some clinical condition, you actually stop thinking You label something as its cause, something as its reason, and since now you've found the reason, you don't find any reason to think further, to explore further, to discover further, to invent further, and to improve yourself. So this is a full stop mechanism which all of us should guard against all the time. Thank you so much.
Okay, Rahul, once again, like if you can hear, please unmute and speak. Otherwise, I think it's time for us to conclude. But Dr. Abby, shall we wind up or what?
Yes, I think we can. I think we can.
Dr. Podhuwal, if you have any evidence, like you can send us a back channel message, or we'll be around Clubhouse. So you don't, I don't think you have any difficulty finding us. So we are open, and we'll come back to you later.
Okay, guys.
Ayuba, are you? Yes.
Okay, guys. Thank you. Thank you.
Yeah.
Thank you, everybody, for tuning in. We'll meet weekly once. And please follow the room, Modern Ayush Detox Room, and we'll have English discussions almost every week from next week onwards, and we'll advertise the topics 3 to 4 days beforehand. Thank you so much.
Thank you.
Thank you, Tony. Good night, everyone.